Hello, everyone, and thank you for joining us. My name is Lauren Powlovich, and I am the Associate Chief Medical Officer at the Foundation. Today, we will hear from Dr. Suzanne LeBlang, the Foundation's Director of Clinical Relationships, on the exciting things happening in the world of focused ultrasound for pediatric patients. Dr. LeBlang and myself are the lead scientific and clinical officers of the newly invigorated Pediatrics program here at the Foundation. And we are hopeful that through continued support of this program, focused ultrasound will expand its reach to benefit many more pediatric patients with a variety of diseases and conditions. Before we get started, a few technical items. If your connection is lost, please simply log in again through the link you received when you registered. At the conclusion of today's webinar, you will receive a link to the webinar recording as well. After the presentation, myself and Dr. LeBlang will return to the screen for further discussion. We encourage active participation from the audience, so please submit questions to us through the Q&A function at the bottom of your screen. Now, let's hear from Susie.
Thank you so much for the introduction, and thank you all for joining us today. I'm very excited to talk to you about pediatric applications of focused ultrasound. I'll start with giving you a little bit of background of the technology, then update you on the current state of the field and clinical trials. We're going to go through some of the mechanisms of action that are being used today to treat patients. And those mechanisms of action of how we use the beam are thermal ablation, targeted drug delivery, blood-brain barrier opening, which is going to start in 2021, and neuromodulation. And then I'll finish by showing you some clinical cases where focused ultrasound has already been used to help patients. Now, focused ultrasound is a novel emerging technology that uses an external acoustic transducer, that means outside the body, to target tissues deep inside the body. A really good analogy to use is something that you all probably did when you were young. And if you went outside and you took a magnifying glass and you took the sun's rays and used the magnifying glass to make the sun's rays converge at a focal spot on the leaf, at that focal spot, you could make the leaf catch on fire. Well, we can do the same thing with an ultrasound beam. We can converge all of the beams of a focused ultrasound machine, make them converge at a spot deep in the body, and cause a variety of biological effects. And the advantage here is that it's non-invasive, so there's no skin incisions, there's no radiation. Since we're not piercing the skin at all, there's no risk of infection or bleeding, and it can be repeated as often as necessary. So let me show you this video and then you'll understand how it works. So again, just like the sun's rays converge at a focal spot, we can take the ultrasound beam and make it converge, let's say at a tumor inside the body. And it goes through all the normal tissue on the way to the tumor, but only in the tumor or the target area can we cause a biologic effect. According to the 2020 State of the Field report, which is published by the Focused Ultrasound Foundation and available on our website, the number of clinical indications at various stages of research and regulatory approval has been dramatically increasing. On the left side, you can see the number of adult clinical indications has increased from 63 in 2012 to over 136 in 2019. And although the pediatric indications have been lagging behind, there has been an increase. So there were 3 clinical indications in 2012, and now we have up to 17 in 2019. So this is very exciting that we're starting to get some growth in the pediatric area. In terms of the number of clinical trials, there are currently 9, 5 that involve the musculoskeletal system, 2 that involve oncology, 1 in the neurologic realm, and 1 involving cardiovascular diseases. And the mechanisms of action, as I stated before, are varied. In the MSK or musculoskeletal applications, we're mostly using thermal ablation. In the oncologic cases, we're using thermal ablation and targeted drug delivery. For neurologic applications, we're using thermal ablation and neuromodulation. And in the cardiovascular applications, we're using thermal ablation. So let me explain to you what these mechanisms of action are. So thermal ablation is a way that we can use the focused ultrasound beam to raise the temperature of targeted tissues to above 60 degrees Celsius. That's pretty hot. And in that small area, we cause coagulative necrosis and cell death. So as shown in this diagram, we can target a tissue, let's say in the pelvis here, and in this specific area where all those beams converge at a focal spot, we can cause coagulative necrosis or cell death in the tumor and spare the normal surrounding healthy cells. And we can do this with a very high degree of precision. Now, in order to do this, we can use imaging guidance with either MRI scans or ultrasound, and both of them have certain advantages. With MRI scan, we can actually monitor the temperature in that tissue, so we can make sure we reach that 60 degrees Celsius. And as you know, MRI is the best way we have at looking at anatomy, so the pictures are beautiful, and you can see the tumor and the surrounding normal tissue very easily. The advantage of ultrasound guidance is that you get real-time spatial resolution. As you're scanning, you can see the images right away, whereas with MRI scan, you have to take the pictures and then visualize them later. With ultrasound, you can also monitor the treatment effects real time by seeing changes in the tissue echogenicity, although we cannot monitor the actual exact temperature like we can with MRI scan. Ultrasound also has demonstrated advantages where the treatment times can be shorter than in an MRI scanner, and it's likely going to be cheaper because the machines are cheaper. Another mechanism of action of focused ultrasound is targeted drug delivery, and this is super cool. So focused ultrasound can allow for the enhanced release of various encapsulated therapeutics and increases the local drug concentration as shown here in this diagram. So here we see the yellow focused ultrasound beam coming down into, let's say, the blood vessel. And inside this blood vessel, we have thermosensitive liposomes. This is a carrier vehicle, and inside the carrier vehicle are certain drugs, as shown here in orange. Well, the focused ultrasound beam can open up those thermosensitive liposomes and release the drug. Since there's increased concentration of drug in the bloodstream right there, it can diffuse into the tissue where you see the tumor cells in brown here and the healthy cells in pink. And you can see the increased amount of drug delivered right into the tumor while there's very little drug in the surrounding normal cells. So this is targeted drug delivery. Again, we can increase the local drug concentration. The focused ultrasound beam has also been shown to increase the cell membrane permeability, meaning that these tumor cells will open up their membranes a little bit to allow for the drugs to get inside the cells as well. And it can also cause vasodilation of the vessel. So there's more blood flow going through that area and more drug released. And the overall importance of this is that, number one, you get increased drug concentration to the cells to kill the tumor. And number two, there's less bioavailable drug to the rest of the body. So you decrease systemic toxicity to the normal cells all over the body. Another way of performing targeted drug delivery is in the brain. And this is a little bit different than in the rest of the body, because normally we have what's called a blood-brain barrier, and the blood vessels in our brain are very different. It protects our brain so that viruses and other things that we get in our body don't go directly into our brain parenchyma, but it's also bad because it prevents therapeutics from getting into the brain. So it's a double-edged sword. So what we've shown is that low intensity focused ultrasound can actually safely and reversibly open the blood-brain barrier in a very specific region, like in a tumor or in a place that's causing epilepsy, and we can get drug delivery into that region. And hundreds of cases of blood-brain barrier opening have been performed in the adult population with glioblastomas and other diseases. So now we're very excited about starting blood-brain barrier opening in children in 2021. And the way that it gets the drug through this blood-brain barrier is by opening the tight junctions. So you can see here, number one, we see these endothelial cells kind of open up the space in between them to allow the drugs, whether it's a chemotherapy drug, an antibody, or a virus that we want to penetrate into the tumor. We can see it going in. Number two, the endothelial cells can actually pick up these therapeutics and transport them into the tumor, as shown here. And number three, the focused ultrasound machine has also been shown to decrease efflux transporter function. And it sounds complicated, but basically we have these proteins that normally pump drugs from the brain parenchyma back into the circulation, but the focused ultrasound beam has been shown to possibly decrease the function of this. So when the drugs get into the tumor, they don't go back into the bloodstream. So this is very exciting that we're starting these studies in 2021. The last mechanism of action that I want to describe to you today is with neuromodulation. And again, we can use this focused ultrasound beam to either suppress or decrease the functioning of certain nerves that are working too hard, as shown here in red, or we can stimulate the nerves and make them function more, like in green. And what's great about neuromodulation is that there's no permanent tissue destruction, and it can be used for a variety of disorders like epilepsy, control of pain, or even some psychiatric disorders. So now let me show you a few cases. Let's start with musculoskeletal indications. And one of the most well-known application of focused ultrasound in the pediatric population is with osteoid osteoma. And this is very exciting because we finally got FDA approval in November of 2020 to treat osteoid osteomas. And it's the first pretty much dedicated pediatric FDA application of focused ultrasound. So very exciting. So this tumor occurs in about 11% of all the benign bone tumors in kids. And it usually occurs in the diaphysis of long bones in kids between the ages of 10 and 30. And it's very specific in terms of its presentation. These patients have severe pain at night due to the release of prostaglandins by the tumor, and the pain is relieved by NSAIDs. The current treatments involve surgery or invasive treatments like radiofrequency ablation. And I'll show you the case here on a treatment day. The doctors used the CT scan and the MRI scans shown here to localize the osteoid osteoma, which is shown here with the yellow arrow. There's this little lucent area surrounded by an area of white sclerosis with periosteal reaction, meaning that there's bone forming there due to inflammation. And even though this tumor is very small, it causes a tremendous amount of pain and suffering. So during the focused ultrasound treatment, they localized that nidus because we want to ablate or kill the nidus so it doesn't cause the pain anymore. The yellow here outlines the path of the focused ultrasound beam on the way to the nidus. These are thermal images, so the yellow color shows the elevation of temperature. Remember, we want to get above 60 degrees Celsius to kill that area. And then after the procedure, immediately after the procedure, we give contrast and we can see that this nidus is now all black. There's no more blood flow to the area, so it's completely dead. Now, we've also shown with osteoid osteoma that not only do we decrease the pain, but we can actually heal that bone so it starts to look normal. So here are two fascinating cases. On the left, there's a case of a patient that had an osteoid osteoma, as shown here in the white arrow, with increased blood flow from all the inflammation. This patient had a pain score of 9, which is 0 out of 10, with 10 being the worst. And then at 2 years, the patient remained pain-free with a score of 0. And you can see that there's no more increased blood flow to the area. So we could prove that that area is now physiologically better as well. So there's no more increased blood flow. And in this separate case where the patient had an osteoid osteoma, over time, you can see that the bone completely heals after the focused ultrasound therapy and looks normal after several years out on this CAT scan. Another musculoskeletal disease that we can treat with focused ultrasound is a desmoid tumor. And this is a locally aggressive tumor that infiltrates the adjacent tissues. And therefore, it's very difficult to treat with surgery. In fact, there's almost a 50% recurrence after surgery, which warrants additional surgery, radiation therapy, chemotherapy, or targeted molecular therapy. So it's a very difficult tumor to treat. So let me show you on this case. You can see there's a large enhancing tumor in this patient's leg. So this was it before the high intensity focused ultrasound treatment. And immediately after treatment, you can see this black area, which is that area of necrosis or tissue death right away after the treatment. Now, I'd like you to see what happens to a desmoid tumor over time after focused ultrasound treatment. This journey is about a young boy named Harrison, as shown here in the picture. Soon after this picture was taken, he started developing a mass in the palm of his hand. And this MRI scan shows this large enhancing mass in his hand. And it became very painful, and you could even see it, and it was very uncomfortable. But instead of me telling you about this desmoid tumor, I'd like you to hear it directly from Harrison himself.
I was 13 years old. I was in seventh grade when I began to notice the tumor in my right hand. And I was at IMG Academy near Sarasota, Florida. And I was actually working out in the morning. It was one of those early morning workouts. It was around 7 a.m. and we were doing push-ups. And then I realized a lot of pain in my right hand, in the lower portion of my right hand. And I went to their trainer and they said that it was probably a cyst and not to worry about it. So as my tumor grew, I began to lose sensation around my ulnar nerve. So I was still able to hold pens. I was highly recommended to quit lacrosse because every time I would catch the ball, the shaft would hit my tumor, which would cause pain. And then, so I had to quit lacrosse, which I played since first grade or second grade. So that was a huge hit to my sports career and part of my social life as well, considering every single weekend we were playing lacrosse and going to tournaments. Also, because of the tumor, there was this entire social aspect and almost like a social embarrassment because I was in 12th grade and I had a tumor the size of a golf ball on my hand. So it was pretty embarrassing. Both my grandmas had gone through chemo, and I knew you lose your hair in chemo. So I knew that was not going to be a proper treatment, or that wasn't going to be a treatment that was the top of our list, considering the effects it has, especially as a 12-year-old. And outside of that, they said they could do surgery, and I thought surgery was a great option until they said that they weren't clear margins and they could hit my ulnar nerve, and then I might not feel my hand for the rest of my life. And my hand now feels the same as my left hand. Thank God that I don't have the tumor anymore. The tumor definitely affected my life. I was able to play lacrosse again senior year. So I returned my senior year to play lacrosse, and I earned academic All-American my first year coming back. As a senior, we went to the state semifinals, and it was truly an incredible experience. So without Dr. Gudani, without the team at Stanford, without you, I wouldn't have been able to do all the incredible things I am now.
So I hope you enjoyed hearing those words directly from Harrison himself and his experience of benefiting from focused ultrasound. So I'd like to show you that 2 years after his treatment, this was a picture of his MRI scan. And as you can see, there's no more enhancing tumor left in that location. He was, as you heard, able to play lacrosse again, what he loved, at a very high level. And again, years later, you can see that his hand looks completely normal compared to when he had the tumor. So focused ultrasound was definitely able to help him and really bring back his quality of life. And I'd like to tell you that Harrison is now an undergraduate student at Stanford University and keeps in touch with Dr. Ganouni. Sarcomas are also a very ominous tumor in the pediatric population, and it's one of the tumors that is being treated in our oncologic realm. Metastatic and recurrent sarcomas have a 5-year overall survival rate of only 20 to 25%. And again, current treatment options include surgery, radiation, and chemotherapy, with a lot of morbidity to the patients as well. So there are 2 clinical trials ongoing right now for pediatric solid tumors, including sarcomas. One of them is using thermal ablation, where we use the heat to kill the tumor, like I showed you before. And the other one is using that targeted drug delivery. So we're using those liposomal doxorubicin thermosensitive encapsulated structures to deliver the drugs directly to the tumor. And in this picture over here, you can see how we're theoretically targeting an area of sarcoma with the focused ultrasound in preparation for treatment. Onto some neurologic cases. This is a case of a hypothalamic hamartoma. This is a rare benign brain tumor that emerges during fetal development, but they don't present till later in life. They usually present in the teenage years with precocious puberty or epilepsy and seizures. The current treatment options include surgery, medications, invasive radiofrequency lesioning, or even radiation therapy. So high-intensity focused ultrasound can help and has helped in these cases by either thermally ablating the tumor, meaning we can direct that focused ultrasound beam very deep into the brain where you see this tumor almost at the center of the brain, and we can ablate that tissue and spare all the normal surrounding soft tissues. And remember, along the way, there's no damage to the brain tissue along the path of the beam. Only where the focused ultrasound beam converges at that focal spot deep in the brain will we cause tissue change. So we can ablate these tissues, and we can also do neuromodulation to these tissues where we can kind of perform a disconnection. So the areas that are connecting this tumor to the rest of the brain are no longer functioning. So this is a very exciting study that's ongoing. What's exciting in 2021 is that we're now branching from benign brain tumors to malignant brain tumors. And this diffuse intrinsic pontine glioma is commonly located in the brain stem, which is shown here, which is very, very deep in the brain. So you can see this enhancing DIPG tumor deep in the brain. The mortality is 90% at 2 years. So these patients really need some kind of new novel treatment to help them, because the current treatments are not working, which includes usually a combination of surgery, medications, radiofrequency ablation, or radiation therapy. Many of these tumors are not even surgically resectable because of their deep location. But what's very exciting is that focused ultrasound is going to be used to do targeted drug delivery to this deep-seated tumor. And a very interesting publication came out in 2018 where they used focused ultrasound to do blood-brain barrier disruption with targeted drug delivery with doxorubicin. And what they showed was that the combination of focused ultrasound, microbubbles, and the doxorubicin drug, in that combination, was able to deliver increased concentration of drugs to the brainstem compared to the other areas of the brain, and compared to just microbubbles and drug alone, or focused ultrasound and drug alone. It's the combination of the focused ultrasound, the microbubbles, and the doxorubicin that really can increase the concentration of drug in that area. The last area that we can make an effect is with cardiovascular diseases, and vascular malformations have been treated with focused ultrasound. Venous malformations are actually the most common subset of vascular malformations overall. They're usually present at birth, but they become clinically evident later in life, and they can cause a lot of morbidity with pain and discomfort. Current treatment options include invasive sclerotherapy, surgery, or other ablation techniques. So here's a case that was treated with focused ultrasound. The arrow is pointing to this area of enhancement, which is an abnormal collection of blood cells and blood vessels that you can see here. After the focused ultrasound treatment, you can see that area of ablation where there's no longer flow to those abnormal blood vessels. And over time, you can see that it actually decreases and is resolving over time. So it's very exciting. So I know this was brief, but I hope that you're as excited as I am about the applications of focused ultrasound to the pediatric population. I provided you a little bit of background of focused ultrasound and the current state of the field, that the number of clinical trials is now finally increasing. And I think this is as a result of our success in the adult population. The 4 mechanisms of action that we're using in the pediatric population are thermal ablation, targeted drug delivery, blood-brain barrier opening, which is going to start this year, and neuromodulation. And I've shown you some clinical cases that have really made an impact in the pediatric population already, such as musculoskeletal disorders with osteoid osteomas and desmoid tumors, and oncology with sarcomas, neurologic diseases with both benign and now malignant tumors in the brain, and cardiovascular diseases such as vascular malformations. So thank you for your time and attention, and I welcome any questions and look forward to our discussion.
So thanks again, everyone, for joining us, and I hope you enjoyed the presentation as much as I did. and we're going to dive into some questions now. So thanks again for being here, everyone. So the first question for you, Susie, that I have today is, why do you think that focused ultrasound is such an attractive treatment option for the pediatric population?
It's a great question. And I think it's particularly attractive to the pediatric population for a number of reasons. Number one, it's completely non-invasive. And I know you have children and I have children. And anytime I took them to the pediatrician's office, even for a simple blood draw, it's frightening for kids to have something stuck inside their body. And to have to calm them down and explain it to them takes a lot of time. And sometimes things don't go easily. So anytime we can do something to help children without having to do an invasive procedure, it's a win-win, right? So number one, it's completely non-invasive. Number two, there's no radiation, right? Again, very important. There's a lot of talk in the medical world now about radiation exposure overall, and especially trying to decrease medical exposure of radiation, especially in the pediatric population. So number one, we want to decrease it for diagnostic uses. So CAT scans and x-rays are types of radiation. MRI and ultrasound are not types of radiation, but anytime we can avoid the use of therapeutic radiation, like we typically use for brain tumors or something, that would be great. So number one, it's non-invasive. Number two, there's no radiation. Number three, the fact that we can use MRI and ultrasound, which is no radiation, for precise anatomic imaging really lets us have control over where we're delivering that beam. So it really provides very high anatomic resolution for us to make sure we're doing a good job ablating the tumor or providing for targeted drug delivery. The other thing that's great about that is because there's no radiation and it's very precise, if one of these tumors happens to grow back, which is possible, we can repeat it. We can repeat it as often as we need to. Again, it's safe, it's non-invasive, and no radiation. Another advantage of doing this type of procedure in the pediatric population especially is that because they're non-invasive, we can use much less anesthesia, much less heavier narcotics to sedate these children. They have to stay still during the procedures, but we don't need to use heavy sedation and heavy medications to accomplish that as needed in typical conventional surgeries. So again, I think there are really a lot of advantages to using focused ultrasound, especially in the pediatric population.
Wow, thank you. Yeah, that was a great answer. I can definitely see, where the attraction lies with this technology. And like I've said, I'm just really excited to see where it goes. So we have a couple of questions from the audience that I wanted to address. The first one is from somebody who has a child who's actually been diagnosed with a brain tumor actually as far back as 2015 and has been dealing with, the treatments related to that for his child. And he is interested in high intensity focused ultrasound and wants to know more about how he can get connected to potential clinical trials or just learn more about where we're at in terms of focused ultrasound for his child.
Mm-hmm. Well, first of all, whoever you are out there, I'm very sorry to hear that you're dealing with this. But I want you to know that there's hope and there are technological advances happening all the time. And I'm glad you're on this webinar. We have extensive material to kind of help you navigate this space. We have an amazing website, FUSFoundation.org, where you can find information about either your specific disease. You can also find specific treatment sites that are offering clinical trials. I don't know if you're here in the United States or somewhere else in the world, but there are clinical sites and even commercial treatment sites that are listed for a variety of disorders on our website. So I encourage you to really look throughout our website and find that information. And if you have any specific questions, you can always email Lauren or myself or Dr. Tim Meekum, who's our Chief Medical Officer, and we can absolutely help direct you to a site or give you any additional information. So I don't know the specifics of your case, but the website is surely a great source to start from, and then feel free to contact us.
Thank you. Another question, it's a little bit more detailed, but does the focused ultrasound treatment have any effect on the growth plate if you were to, use it in an area that's close to a growth plate in one of the long bones?
Yeah, no, that's a very, very interesting question. And Anytime you're dealing with either a fracture or a tumor near the growth plate, you always want to worry about what effect it may have on future growth. So I don't know exactly, but I would be cautious that you have to be very careful if there is a lesion near a growth plate, that you don't want to cause any injury to the growth plate itself. And bone heats up tremendously with focused ultrasound ablation, which is why it's so successful. In fact, bone heats up almost 20 times as much as soft tissues with the same amount of energy of the ultrasound beam. And again, that's why we use it to treat osteoid osteomas, and we use it to kill nerves along the bone for painful bone metastases. And even in Asia, they're using it as a treatment for a primary bone tumor. So bone does absorb a lot of energy. So I do think that you would need to be cautious about targeting lesions that are near or along the growth plate.
Thank you. And then one other technical question before I get back to some of the more general questions is what happens to the necrotic tissue after the focused ultrasound treatment?
Yep, great question. So all the time in our bodies, we have new cells that are being born and living, and dead cells that are being excreted in our waste, either in our urine or in our stools. So we have a constant turnover of cells. And we actually have these cells called macrophages. They're like Pac-Man cells, and they go throughout our body and they kind of pick up debris and dead cells and excrete it. So anytime we kill tissue, like with thermal ablation, and we create dead cells, our body cleans it up and then gets rid of it. And that's how these tumors shrink over time, like Harrison's hand, and it just shrinks over time. The dead material gets resorbed. So good question.
I just want to say thank you to all the questions coming in. We're getting quite a few, so I'll ask one other question. What is the relationship between tumor volume and time to ablate?
Yep, great question. So we are able to control the amount of tumor ablation per sonication. So a sonication is one individual time period where we kill tissue. And that sonication usually lasts anywhere from like 20 seconds to 60 seconds. And we can kill a volume of tissue as small as a grain of rice, like 1 millimeter by 4 millimeters, up to 10 millimeters by 1 centimeter by 4 centimeters. So as small as a grain of rice, as big as a large coffee bean, or something like that. So we can control the size of it. So depending on the size of the tumor and where it is, we want to safely ablate that tumor. So we use different sized cells, like the rice or the coffee bean, to ablate the tissue. So again, depending on the larger size, it may take some time. For the the desmoid tumor that I showed you in the leg, or let's say a uterine fibroid in your uterus, it can take up to 2 to 4 hours sometimes to ablate a tumor. But in a small tumor, like in an osteoid osteoma, it could take much less time, maybe 30 minutes or an hour.
Thank you, Susie. And when you're using thermal ablation in the brain, is there a limit on the size of the target or the location in the brain where it can be done safely at this point in time?
Mm-hmm. Great question. So remember the analogy that I told you that the beam converges at a focal spot? The brain presents a little bit of a unique problem because we have to get through the skull. And we have all these mathematical correlations that adjust the beam to go through the skull so it doesn't get deformed and it doesn't meet at the focal spot. So we need a little bit of a distance for that beam to really converge at a focal spot in the brain. So that's why the lesions we can treat now in the brain are deep within the brain, so the beam has time to converge at the focal spot. So right now, the tumors and the areas that we can use thermal ablation in the brain are deeper seated lesions. There are technical advances happening all the time that are trying to expand that treatment envelope to go more superficial towards the cortical surface. So right now, the tumors are deep in the brain, and according to the size of the lesion, again, it depends how deep it is and where it is.
Thank you, Susie. So in reference to one of the slides that you showed during your presentation, there was a graph rather that showed the number of indications is really growing in this field from the State of the Field report. And it's growing much faster in the adult population than it is in the pediatrics population, although it is encouraging to see that there is growth in the field within pediatrics as well. But why do you think it is that pediatric indications have lagged so far behind the adult conditions?
Yeah, it's a good thing and it's a bad thing. It's a good thing because I think in kids, you really don't want to use them as the first test pilot, right? You just kind of just want to make sure that you're doing everything exactly correct, and not to say
Right.
that adults are guinea pigs, but I think it's a little bit safer to try things in adults first. And I think the FDA and all kinds of regulatory agencies are a little bit more careful about making sure there's enough preclinical and technical research that confirms that it will be safely translatable into humans. But I do think we have ample evidence in adults in a variety of these similar disease processes that have shown that it's safe, that we can then translate into children. Having said that, the FDA is becoming much more understanding that there are rare pediatric diseases that warrant technical advances to get to market now to help children and not wait a few years. So they are being more understanding of getting certain clinical trials approved for pediatric diseases. But again, we have to make sure that we have done the necessary preclinical and technical studies to make sure that's safe and feasible, and any additional information that we can glean from the adult studies will always help us make it better for children.
Yeah. Along similar lines, we've got another question from the audience about whether or not there have been specific devices that were designed for the pediatric population, or are we just taking adult devices and scaling those down and using them for the pediatric population?
Okay, so whoever asked that question needs to come work at the Focused Ultrasound Foundation.
Yeah.
Because we need you. As the foundation, we work with dozens of manufacturers, and manufacturers like to kind of concentrate on specific disease processes. And your question is great. Right now, we're taking adult machines and using them for pediatric indications, but there's definitely a need to make these machines more comfortable and different sizes to adapt to the pediatric population. So the Focused Ultrasound Foundation is dedicated in our new pediatric program to dedicating a certain amount of money, especially in 2021, towards advancing the field of pediatric applications. And some of that may involve making certain pediatric machines. So that's a great question, and come work for the foundation.
Yeah, I'm absolutely hopeful that, as we advance the field in this area, there will be technologic advances that match the research and the development of these new treatment options. So that is a great question, though. So we kind of already started to talk about some of the things that the foundation is doing in order to advance this mission. But can you speak a little bit more about what we're doing as a foundation to accelerate the adoption of this technology in the pediatric population?
Yes, and I may check my notes right here a little bit because I don't want to miss a thing, because we are doing a lot of things, okay?
Yeah.
So the first thing that was very exciting is that we have a dedicated focused ultrasound center of excellence that is just involving the pediatric population. So Children's National Hospital is now a dedicated center of excellence of the Focused Ultrasound Foundation, and they perform incredible preclinical and clinical research with various pediatric diseases. And when they earned the title of a center of excellence, it enables them to have additional funding from the Focused Ultrasound Foundation to perform research over a period of 3 years to ensure that we are aiding in the progress and advancement of the treatment of pediatric diseases. So that's the first thing. We have a dedicated pediatric center of excellence. The second thing is we have workshops to convene the community of people and experts around the world to study specific pediatric disease processes. So we just had a dedicated benign pediatric brain tumor workshop that Dr. Tim Meekum, our Chief Medical Officer, hosted, which was incredibly successful. And we had pediatric neurosurgeons that really were very transparent in how they believe the future of treatments should include focused ultrasound as a possible tool in their armamentarium. We're about to have a dedicated workshop for DIPG, that tumor that I talked about in the PowerPoint lecture. So we're going to convene experts from all around the world to decide which drug is best for DIPG tumors, which mechanism of action is best to keep moving the field forward in addition to targeted drug delivery. And there are so many other mechanisms of action that we haven't had time to talk about today, but we'll talk about at the workshop, and how to ablate and kill those tumors. So keep posted about that workshop, because we always write a white paper up on the outcome of those workshops to ask these burning questions of how we can move the field forward. So we have workshops. We formed a pediatric scientific advisory board. So that's where we search out experts from all around the world. And it's usually comprised of about 4 to 7 people. And we meet a couple of times a month to kind of help steer our pediatric program in the right direction to where there's the most need and the most potential advancements in the near future. So we have experts now from Children's Hospital of Philadelphia, from Children's National Hospital, and various other locations, and the Nicholas Children's Hospital in Miami. So we're very excited about our Pediatric Scientific Advisory Board. Other things that we are dedicated to advancing the field is that we just finished writing a review paper on pediatric applications of focused ultrasound in concert with Children's National Hospital and Stanford University. So we hope to get the word out and educate different types of physicians that deal with pediatric populations about focused ultrasound. And we just keep going, just keep moving.
Yeah, I mean, geez, that's a lot of stuff. So thank you for just, informing us on some of the really amazing work that the foundation is doing to make sure that this technology reaches the pediatric population as soon as possible. There is another question from the audience that I'd like to ask, and I'm not sure that we'll be able to answer this one, but I think it's an important one just to sort of highlight the fact that we are thinking about this on a day-to-day basis. So how soon is the DIPG clinical trial for targeted drug delivery going to begin?
Yeah, great question. And we're very excited about this study. The site that will be conducting this study has received most of its regulatory approvals. With COVID, there has been a slightly delayed recruitment of patients into studies, but we've already seen an uptick since January of this year. So I can't answer, as Lauren said, that question exactly, but we are extremely hopeful that the first patient will be recruited in the next few months.
Thank you. Yes, we're very excited about that. So stay tuned. All right, let me see. I'm gonna go back to my questions. So is there a condition that you hope to see focused ultrasound being used for in the near future?
Yeah, that's a tough question. So I'm a neuroradiologist by training, so I have a special predilection for neurological disorders. I think there's tremendous pain and suffering in children with neurofibromatosis. So we've gotten some very interesting research proposals that we're considering funding on very strongly for neurofibromatosis. So that's going to be a super exciting application in the future. I think in the brain, I think pediatric neurological conditions can really be addressed and have an unmet clinical need. There is a pediatric population with multiple sclerosis. I think it would be really important to try to investigate if we can either reverse those changes or improve the myelinization in pediatric multiple sclerosis. So I have a particular predilection for neurological disorders.
Yeah, those all sound like really great options. And I'm just very, very excited and look forward to seeing what we can do here at the foundation to help get this technology out there a little bit more in the pediatric population. All right, so I think that just about wraps us up. I have one final question, and that is that what can those watching this webinar right now do to help advance our mission?
Everybody can help advance our mission. I always tell my kids, everybody can do something. Whether you help spread the word by telling a friend about the webinar or about the website is helpful. Talk to your pediatricians, talk to your friends. Talk about these cool mechanisms of action to your kids about science. I mean, it's just so cool, like what we can do now. So number one is you can help spread the word and educate and increase awareness. Number two, please visit the Focused Ultrasound Foundation website and find out about all of the interesting workshops and different things that we're doing to help pediatrics and other diseases as well. So get our newsletter and then keep up to date on that. And if you have a particular passion for a specific pediatric disease, please contact us. We always have focus groups that help us kind of talk about which pediatric diseases we should concentrate on. And if you know of any other nonprofits, we work very closely with other organizations to co-fund research projects or to increase awareness. So if you know anyone that's in a nonprofit space that deals with pediatric diseases, please let us know and help connect us to them so everyone can do something.
That's right. All right, well, thank you so much again, Susie, for your presentation and just answering these interesting questions. There were a couple of questions that we didn't get to, but if you'd like to know more about the foundation or just focused ultrasound and pediatrics in general, please visit our website, fussfoundation.org, or email us at info@fussfoundation.org. And thank you again so much to everybody for joining us today. Stay tuned to our newsletter and website for invitations to future webinars. Have a great rest of your day.